Hello, Dr. Kasandra here from Charleston Chiropractic Studio, and today I'm going to demonstrate how to use your pelvic blocks for what we would call a pelvic rotation. Essentially, when your hips or pelvis is out of alignment, the entire pelvis moves or misaligns as a unit. So what happens is it'll rotate where your hips will go forward on one side and backwards on the other side and create a lot of imbalance in your entire spine, your whole kinetic chain, create a lot of low back pain, hip, knee, ankle issues as well. So first thing I want to show you is exactly where to place these pelvic blocks. So in your home care kit, you should have received these two blocks that look like this. The bottom flat surface is what's going to be going on the ground, and the nice 45-degree angle is what's going to be placed under your pelvis. So the pelvic blocks are very simple to use. What you're going to be doing is placing them specifically under your pelvis at the right angle for a simple 3 minutes a day, and it's what we call a static exercise, where it's essentially resetting the pelvis into the right position and really molding and shaping and addressing the soft tissue component of the misalignment. So on your paperwork, you're going to see either a right high, left low, or left high, right low. What that means is which block is going to be high or low when you're placed underneath you. So whichever one that says high is important for you to know. You're going to essentially place it under your SI joint, or kind of right at the top of your pelvic rim. The low side is going to be placed right under the bone that you sit on, what we call the ischium or the sit bone. And while they're placed underneath you, you want them, again, that flat side going on the floor or a nice firm surface, and they're going to be positioning or facing towards each other underneath you. So to demonstrate, again, on a nice flat firm surface, the floor, but not your bed. You're going to assume the position of laying down, and we're going to assume that I'm a right high, left low. So on a right high, you're going to take the lower angle here, and this is the one you're going to kind of shimmy underneath you. So right high, I'm finding my iliac crest, and I'm going to put it under me at a 45-degree angle down. Then the left low, same thing, nice flat on the ground. This is what's going to come underneath me, and I'm going right under my sit bone at that 45-degree angle underneath me. I'm going to lengthen my legs, and right away I can already feel how this is shifting my pelvis. And again, these blocks are facing one another, creating a linear angle underneath me. If we were to be a right low, left high, it is going to be the exact opposite. So you can see from this angle, I'm going to find my sit bone essentially right under my glute, and I'm going to have it pointing at a 45-degree angle forwards, almost towards my belly button. And then the left high is going to be under my pelvic rim, facing that 45-degree angle to make that line underneath. And I'm going to drop my legs, and again, now I can feel how this is shifting my pelvis. So I hope that makes sense. Please refer to the document that we gave you, because we do have all of the images there for you as well. But what you want to make sure is as you are placing them underneath you, that they are at that 45-degree angle. What we see a lot of patients do, which is not right, is they're going straight underneath them, which will not correct the pelvis. So you want that nice 45-degree angle down. You could start by doing this for 3 minutes a day, working your way up, adding 1 minute to the time each day if you're not sore at all, and with a max amount of treatment time of 20 minutes. One important thing to know is that if you have been prescribed the cervical orthosis to help improve the curvature in your neck, you can actually perform that and the pelvic blocking at the exact same time.